Dr. Roger Albin is a graduate of University of Pittsburgh School of Medicine. He received clinical and postdoctoral training at the University of Michigan, where his mentors were Ann Young and the late Jack Penny. He's now the Ann Young Collegiate Professor of Neurology at U of M. His primary research interest is the pathophysiology of basal ganglia disorders, including Parkinson's disease, Tourette syndrome, and Huntington's disease. He's currently the co-director of the Parkinson's Disease and Movement Disorders Division and director of the Udall Center at the University of Michigan, as well as associate director for research at the Ann Arbor VA Health System Geriatric Research, Education, and Clinical Center. Please welcome Dr. Albin.
We're all set there?
Yep.
Okay, thanks. Everybody hear me okay? All right, well, thanks for coming this afternoon, particularly on such a beautiful day. And thanks to Laura and Laura for organization. They're really the people who are responsible for this event. I'll put in a plug for all the resources the Parkinson's Foundation has, which are really unusually good. And specifically for the hospital care thing, anytime you're having a hospitalization, even an elective hospitalization, you should always bend over backwards to pay attention to that. Most physicians, I think, our surgeons in particular, are tuned into the needs of Parkinson's patients, but just in case, it's a smart idea to be careful about that. So I'm the director of the Udall Center at the University of Michigan. The Udall Center is an NIH-sponsored research program. We're sponsored by the National Institutes of Neurological Disorders and Stroke, primarily to focus on research related to Parkinson's disease. And the goal of the Udall Center's program is ultimately to improve the care of Parkinson's disease, primarily by enhancing our understanding of different aspects of Parkinson's disease. So this is actually the title of our grant from NIH, which has the usual long, complicated title, which is really sort of necessary for grant applications. But basically, we're interested in a couple of really difficult to manage aspects of Parkinson's disease, which are particularly hard to treat: the gait and balance problems, which I think some of you are quite familiar with, and problems with cognition, and how those two things are related to each other. And the goal of the Udall Center in part is to capitalize on a lot of the scientific resources that we have here at the university, across the university, to try and bring talented investigators together to focus on these type of problems. So we have, in our center, we have investigators from the School of Medicine, the School of Public Health, the Department of Psychology, in some cases, really some of the people who are really world leaders in their field. So just to briefly show you a couple of things that we're interested in. And so this is a nice video from the Lancet looking at some aspects of gait, in this case, sort of the freezing phenomenon. And you can see this is a Parkinson's patient who's moved on to that change in color on the floor and actually has gait freezing as he changes the floor. It goes across the borders of that carpet square. And I'm sure some of you have probably experienced this type of freezing problem, and in particular, these type of freezing episodes predispose people to having falls, which is a major cause of morbidity and sometimes actual mortality in Parkinson's patients. Okay. Now, one of the interesting things is this is not clear related to what we historically think of as the major problem with Parkinson's. Most of you are familiar with the idea that there's a loss of dopamine, this important chemical messenger in the brain that's responsible for a lot of the features of Parkinson's disease. And you can see up here on the screen, there's a cartoon showing some of the changes that we see in Parkinson's patients. And also this is PET imaging. This is an advanced brain imaging method, which actually allows us to visualize those specific changes in dopamine. You can see a PD patient who has a marked reduction in those dopamine-producing nerve cells. And what's clear, though, is this kind of gait problem and a lot of the other associated problems in Parkinson's disease are not specifically related to this particular aspect of Parkinson's disease. And in particular, we're interested in the relationship between these kinds of walking and balance problems with cognition. So we tend to think of walking, maintaining your balance as a very simple, straightforward thing, very automatic, but in fact, it's actually quite demanding. If you think about what you're doing when you're walking, you're sort of throwing yourself forward and then sticking your leg out at the last minute to prevent yourself from falling flat on your face. And if a lot of things don't work properly in your brain, particularly with paying attention, then you will fall. So all of us have had that experience of walking and being slightly distracted and actually tripping or actually having an actual fall. And if the brain systems for control of attention, for maintaining your normal awareness of the world around you, even with minor changes in the floor or a curb, then you're going to have an increased risk of a fall. And we're very interested in brain systems that are responsible for this sort of almost subconscious automatic control of these kind of attentional mechanisms and how they interact with your brain, with things like maintaining an upright posture and walking. And to do this, to actually understand this, requires a very large array of investigations. And what we're particularly interested in is a different chemical messenger in the brain, a messenger called acetylcholine. And we can investigate that and how it functions in the brain with a variety of different methods, including both in humans and also in animal experiments to do things that we can't possibly do in humans. And this, just shows you a couple of different things. Again, this is PET imaging. This is a method developed by our radiology group here, actually to look at this particular brain messenger in human beings. And then you can study it in a variety of different ways in humans, including at a in animals, at a very, very carefully defined level of individual cells. And this is what we're trying to do all the way across from human experiments all the way down into very detailed animal experiments to try and understand these systems. And to do this, you can use this method, PET, positron emission tomography. This is a technologically very advanced method. It uses a combination of nuclear physics, advanced chemistry, a lot of engineering. And at the end, the goal is actually to produce a picture with numbers, actual quantification of relevant things in the brain that would be relevant to really a wide variety of clinical problems, in our case for Parkinson's disease. And just as an example, this is just an experiment done by some of our group here, Dr. Bonen's lab. This is a group of Parkinson's patients classified as to how they've changed in terms of their thinking over a 2-year period. And this group, for example, has maintained their thinking. This group has had some problems with thinking and hasn't changed over those periods of time. But we can use this imaging method. You can see the different colored patterns there indicate that there are different patterns in these individuals when they're first scanned, and this actually has some predictive value for what's going to happen to them over the following 2 years. And you can use this kind of information to try and get an idea of what's causing these problems or changes in thinking and potentially to derive some investigations. I'll also mention that we have the good fortune of collaborating. This is actually an international project. We're collaborating with a group in the Netherlands led by Dr. Toys van Laar. And we've had the good luck to have some of his trainees here. We're doing some work. One of our speakers this afternoon, Julia Carley, will be talking to you a little bit about some of the work that she's done. But we've been able to reproduce or parallel a lot of the work that we've done here in Ann Arbor with this group in the Netherlands to try and make sure that we have secure findings. So I'm just going to finish up by showing a couple more things. This is just an example of how you can do an animal experiment to try and get a handle on what's going on in humans. And this is a method developed by our colleague, Dr. Martin Sarter, to actually look at gait and balance, in this case in rats. And you can see a rat going across a rotating beam. This is a normal animal, can just speed across there. And this is the rat which has been manipulated to somewhat mimic features of Parkinson's disease. And you can see him going, and he gets to a doorway there, and these are all male rats as it turns out, he gets stuck. So this is actually kind of like freezings that our patients experience. And just to show this again, there's the animal, this time just sort of gets stuck there. So we can use this kind of thing to actually look and see if what we're seeing in humans is actually relevant and actually to try and figure out in a more detailed way that what we're seeing in humans is actually relevant to the phenomena we're trying to work And just to finish up, we're looking at a very complicated system, and in order to understand this complicated system, we need to have experiments across the whole range from looking at people all the way down to these very detailed, individualized experiments in animals. So I'm just going to finish up by talking a little bit. We have a bunch of projects. I won't mention this, just talking a little bit about human clinical research, which is a major focus here, and just mention a couple of different kinds of research investigations that we have going on. So in general, I think you can think of human clinical research having three different kinds. There's observational research, where we're looking at something in a group of people, and we're measuring something else, and we're trying to figure out how they're related to each other. And those relationships could be, direct, one thing is causing the other, or they just could be, something else going on, just an accident. So these are correlational studies. And they're done in sort of two different ways. There's cross-sectional studies where you just look at people at one time point and see whether there's a relationship, and longitudinal studies where you follow people over time. And then there are interventional studies. And these are studies where we actually do something in subjects or patients. And this gives us an idea of whether or not what we're studying, the things that we're related to each other are actually related to each other. One thing actually cause another. And this is really what you're doing in the clinical trial. If you have an idea about what's causing a feature of a disease, you do an intervention to see if you can change that, hopefully make it better, and that should tell you whether or not that's actually what's actually going on. And finally, there are population-based studies, which may involve usually anonymous data. Anyone here who's enrolled in Medicare, all your Medicare, all your visits are an enormous federal database, and investigators can get permission to look at that data in an anonymous way to actually study different things about different diseases. So briefly, getting back to this, what's an observational study? This is just an example of the study that we showed previously. Here we're looking at different features of Parkinson's patients in terms of their cognition. Are they stable over 2 years? Do they change over 2 years? How do they change? Is that related to these changes in this particular brain chemical messenger? And again, these different patterns that we're seeing with the imaging method give us some idea of whether or not they are related. You can also do this in a longitudinal way. This is an experiment that Julia did. This is actually studying some of our Dutch colleagues' data. And again, this is looking at the same kind of imaging method, the same brain chemical. In this case, these are the same subjects studied 2-3 years apart. So you can look within individuals to see if there are any changes. And again, here these individuals have been classified as to whether or not they've maintained their cognition, whether or not there's been some change, whether or not there's been a lot of change, and we can look at those different patterns to see if they're related to each other. And if you can establish some idea about those relationships, then you have an idea about what you could do potentially to intervene. And in terms of intervening, what you would like to do is have an idea about what's going on, have a target for doing a clinical intervention that you would think produce some benefit. Then you can do what's called target engagement, and this is an idea, is your intervention actually hitting the target? So this is an experiment that we actually did. This thing here at the top is varenicline. This is a drug you've all heard about. This is Chantix, the smoking cessation drug. But we have reason to think that varenicline would actually increase attention. And if it improves attention, then it might be useful for treating gait and balance problems in Parkinson's disease. So we actually did an experiment to see whether or not varenicline would get into the brains of patients with Parkinson's disease in an appropriate way. And again, we used an imaging method, and you can see here, this is a Parkinson's subject either taking varenicline, that's block, or not taking varenicline, same individual unblocked, to see whether or not it actually changed their brain, which it did. And this tells us that we can use this dose of varenicline, which is actually less than the dose used for smoking treatment, and we could actually do that safely in Parkinson's patients. And then you can actually look to see whether or not it's having some kind of effect on what you'd like to measure. In this case, particularly walking and how people respond to distraction when they're walking, and does it improve attention? And this is a typical intervention study. You take a group of subjects, you either give them varenicline, or you give them a placebo and a fake drug. The subject doesn't know what they're getting. The investigators evaluating the subject doesn't know what they're getting. You treat them for several weeks, you take them off whatever they're taking, you put them back on, switch the subjects to the other thing and see what happens. And if it works, then you should see an effect just associated with that particular treatment. In this particular case, we did. Varenicline seemed to improve people's walking when they were distracted, and it seemed to improve their attention in general. And so now you can do a big trial, which is actually to see if this has a prolonged benefit. So right now, we're actually starting a trial using varenicline where we'll treat people for a year, either with varenicline or placebo, and see if it improves their walking, their balance, and reduces falls. So that's sort of a nutshell of the kind of things we do. Many clinical research studies are observational, try and figure out what's going on. Other studies are interventional, where really the primary purpose is to understand, to get an idea of whether or not our observational studies have told us, what they've told us is true, and to try and produce something will actually produce real benefits for patients. So I think all done there, and I'd be happy to take any questions. Yeah, this is public. Some of the published data primarily. Yeah. Yeah. So we can send you the reference if you're interested. Yeah, absolutely. Mm-hmm.
Dr. Albin,
Yeah.
over here.
Yeah.
What does spatial issues have to do with
Yeah.
that? You know, one of the things that I have an issue with is judging
Yeah.
correctly.
Yeah, so this is a common experience, I think, for many Parkinson's patients. This is probably somewhat related, but probably involves a somewhat different part of the brain. I think there is these kind of attentional mechanisms involve, there's a number of aspects to this. These kind of attentional mechanisms involve sort of a very older part of the brain, which virtually all animals have, but many Parkinson's patients have problems with spatial navigation, which understanding, visual navigating space, and that involves probably a part of the brain, particularly called the retrosplenial cortex, sort of trying to integrate a lot of different things, like where you are in space and what the visual world around you is. And actually, one of our Udall Center investigators, Dr. Ahmed, is a world's leading authority on this, is trying to study this specifically in the context of Parkinson's disease. So we hope that this will actually be fruitful in the future.
My question's two-part. Number one, was the study that you just did, I assume was the patient was just on varenicline itself? And then number two, with all the other medications that are typically used, how does varenicline interact with the other medications?
Yeah, so actually we are proposing to do this as an adjunctive therapy in addition to routine therapies. And one of the good things about varenicline is it turns out this is an advantage. It has relatively little in the way of interactions with other drugs. If you've seen that commercial on TV, there's that part at the end where there's some guy talking very, very fast about all the bad things that can happen. By and large, that's really not true. It turns out that varenicline's probably been used several 100,000 times around the world, and those bad things actually are not things that really happen very much at all. If ever related to varenicline, it's a surprisingly safe drug. Yeah. Yes, sir.
So does that mean that it's dealing with different receptors?
Yeah, it is. That's exactly right. So this is it's a receptor, a specific population of receptors. And I will say the reason we got into this is one of our colleagues here was involved in our Udall Center, Dr. Sarter. Dr. Sarter was a world-leading expert on attention, and he had identified this particular group of receptors as being critical for nicotine action. So, varenicline is a nicotine-like drug.